Chair. This is a question that I'll very likely ask other ministries, but I just wanted to specifically find out from your ministry, the Ministry of Health. I recognize after the discussions that we had with the Minister of Mental Health and Addictions that her role, and she made it really, really clear, is a lead role in bringing together other ministries. And she said yesterday that she is going to develop an effective strategy to propose what those programs are and to bring those forward to Treasury Board and to Cabinet for budgetary approval. We will also be building in mechanisms for evaluation of all of our programs as we go forward so that we can adjust when need be and so that we can get the best possible value for the money that's being spent, and in order to ensure that the resources that we're investing really are the most effective possible in building the better system. My role is to lead all of that. So my question to the Minister of Health is, if the Minister of Mental Health and Addictions comes to your ministry during these consultations in Cabinet or the DM meetings or whatever these meetings that you have that bring everybody together, if she comes forward with a proposal that perhaps conflicts in the budgetary process with another ministry, how will the decision-making be determined if she's leading this and is putting forward recommendations with all these other ministries? You can imagine that it's going to be immense, and everybody is going to be wanting more resources, and we know that there's only so much money. How will the decision-making be done so that this system that the Minister of Mental Health and Addictions has brought forward is truly seamless?
Minister.
Of course, the system being seamless involves much more than politicians. It involves a whole system of people working together, and that's our expectation, and that's what we intend to do. The reason we have a new ministry and a new minister for mental health and addictions, and I know this is a proposal that the member supports and has supported in the past, and her committee supported, is that I think it's a fair statement that across Canada, and we'll leave out again the last 16 years in that whole discussion, but across Canada, provincial health systems, and indeed in the United States, state and national health systems, have been less than successful at delivering a coherent mental health agenda, delivering services where people need them. As the minister said yesterday, the kind of services one might expect if we tripped down the stairs and broke our leg later today, right? And so part of the thinking behind the member's recommendation and behind the Premier's direction of creating a new ministry was to give a major voice, and I think it's fair to say the Minister for Mental Health and Addiction is a very significant voice in our caucus and our cabinet. Have someone who wakes up every day driving that agenda. Of course, the policy decisions of government always involve decision of Treasury Board and the Minister of Finance and the Premier. So you have to make a case, a value for money case and a needs case for any proposal you'd make, whether it would be in education or in healthcare or in mental health and addictions or in transportation or wherever it might be. But I think what we've done with a Minister of Mental Health and Addictions, and my mandate is as Minister of Health, and she, with respect to mental health and addictions, is certainly giving direction throughout this, the service delivery and the health authorities. She is the key person. She is the director. She's the person who's driving the mental health and addictions strategy. My job as Minister of Health, because it's such a priority for the Premier, it's such a priority for the government, and it's such a priority for people in communities who, I think, share a sense of loss about the people who have left them. You know, at the First Nations, significant provincial First Nations meeting we held at the beginning of September, my first meeting was with a community where they had lost 7 people from overdose. Not a community like Vancouver, the one I live in, of 800,000 people, but a community of less than 1,000 people, 7 people to overdose. One cannot imagine, I think, the consequences of that for that community, for the families, for the neighbors, for the community life, for what it means to live there. And so that requires action. And so the reason why I think the minister is going to be successful in driving an agenda within the government is because the need is clearly there, because the public support is there, because I think the support from the opposition is there. I think the support from families and people around the province is there. And our job as ministers is to support that effort and to do everything we can to make it happen. And of course, there's always a debate within cabinet about where we should go. But this is clearly a priority area. It's clearly somewhere where we're going to put resources. And as Minister of Health, it's my job to support the Minister of Mental Health and Addiction as she takes on this very difficult and important task.
Member.
Thank you, Chair. So do you anticipate then, because I'm just going to read back your words, that she's the director and she's the leader of the mental health and addictions part of health. Likewise, she would be the leader of the mental health and addictions part of education. Likewise, she would be, am I on the right track? That she would be the leader of the mental health and addictions part of social development, of housing, of MCFD, although I understand that children and youth mental health is still in MCFD. Still, that's where it lives. But my question is, do you see any time that her recommendations, as strong as a minister that she is not going to match what the priority is with the individual ministries?
Thank you, Minister.
Thank you, Honourable Chair. And what we've done within government is there are many processes with which the former minister and the health critic would be familiar. Within government cabinet committees, Treasury Board is obviously a significant cabinet committee, and that's where ultimately spending decisions are approved. And I think every minister goes to Treasury Board humbly and tries to do their best under challenging conditions, because the people at Treasury Board are obviously choosing between and making decisions about the whole range of government spending. In our cabinet structure, we've set up a committee that's led by the Minister of Mental Health and Addictions that deals with this file. It's a cabinet committee. It reflects, and this has happened several times in the past, of significant issues where the Premier has said this issue is important, and we're putting a cabinet committee that reports directly to cabinet about the mental health priorities. I'm on that committee. I'm a member of that committee, and I think the full list is public. I don't have it by memory, but I'm sure the member can have access to that. And really, the responsible ministers that she refers to are all part of that committee. So we're all there. And so when recommendations come out of that committee, they reflect the collective view of the members of that committee. And that's the way cabinets work. And sometimes special committees are set up, but this is a permanent committee of the current government that is going to provide direction and trying to address some of those very questions that the member had yesterday of the minister, which is to ensure that we bring together the many services offered through different ministries of government together in one place and have a decision-making process that's directed through one place into the cabinet process. So does that mean that every proposal we'll set aside the Minister of Mental Health and Addictions, every proposal that I make to Treasury Board or Cabinet will be approved? I can only be hopeful about that. I can only be hopeful about that. But I think in the case of mental health and addictions, we can be more than hopeful in the sense that it is a fundamental priority of our entire government to address some of these questions. Not just the immediate crisis, but I think a long-term crisis in mental health and addictions.
Member, and I remind you to go through the chair.
I'm talking to you, Chair.
I appreciate it so much, yes. If you use the word you, I hope you're speaking to me.
Oh, you. Okay. All right. Sorry. The chair. Sorry. Thank you for that. So I'm going to ask a question, like a hypothetical question, that will perhaps explain where I'm getting at. So, and of course, I'm stuck on my example of Mountainside Secondary in North Vancouver. So as we've canvassed for the last couple of days that there was this proposal that Mountainside Secondary, North Vancouver School District, quite frankly, in West Vancouver, had brought forward and wanted to get a position that was funded by the school district to be the liaison between Vancouver Coastal Health, and at the time, it was before Foundry, but let's for all intents and purposes say it's Foundry, to ensure that a child or youth that is part of the school district, be West Van or North Van, their file, their information, their history is shared amongst the people at Vancouver Coastal Health or Foundry, as well as the teachers and the services that were available in Mountainside. So my question is, so if, for instance, the Minister of Mental Health and Addictions and, say, the Minister of Health thought this is a great idea and then proposed that this was a great idea to the school district, I'm cognizant, I'm sure it wouldn't happen in North Vancouver because they're already on top of it, but say there's another school district, could it kind of fall by the wayside because we always want to make sure that school districts are autonomous, in other words, they make up their own mind what they do with regards to programs, and would we see then a collision of the minds that perhaps there's a great idea that the Minister of Mental Health and Addictions and perhaps Health think this is the greatest idea in a school, except for the school districts goes, no, I don't want that, for whatever reason. So that's what I was kind of getting at, is how is those kind of things going to be addressed?
Minister.
Well, it's a hypothetical question, so I'll give a hypothetical answer. Because the former mayor of Kamloops is here, and it's very distinguished company. And often, what the issue between government and municipalities sometimes is sometimes powers are offered without resources. Unfunded mandates are imposed on municipalities. So part of what you're talking about is really the ordinary cooperation that we would expect between agencies. And that can sometimes be a challenge, even between health authorities. You know, I live 4 blocks from a health authority border, right? And one side of Boundary Road, I'm in Vancouver Coastal Health. The other side, I'm in Fraser Health. And you'd be surprised the differences between those health authorities. I've been surprised since I've become Minister of Health that sometimes there are differences. So it is a challenge in government because we want to have local authority over decision making sometimes to drive initiatives like the one the member's talking about through. But I think you have a better chance on issues of mental health and addiction when you have a minister with a ministry supporting it, driving the agenda consistently within government. And that's what we have. That doesn't mean that you're not going to, on issues, and this is not just true of issues of mental health and addiction, but broadly, there's overlaps between all ministries at all times and between levels of government consistently, much to the frustration sometimes of provincial governments, to federal governments, and municipal governments, provincial governments, et cetera. But we got to do our best to try and get to better solutions. And this is one way that we've designed to do it, which means a cabinet committee, which means a standalone minister, which means a high priority in throne speech and budgets. It means the significant new expenditure in the Ministry of Health is actually directed by the Minister for Mental Health and Addictions on the fentanyl crisis. That demonstrates our commitment, but as the member rightly points out, it will require work every single day, not just by ministers, but by ministries, by staff, by school districts, and by citizens to make sure it works properly.